You know, there's a question about what's happening that's new in our specialty, and one of the big things is what's called PGD, or Prenatal Genetic Diagnostics. What do we mean by that? Well, we have the ability to take a cell from an embryo, if it's good quality, when it's on day 3 or 6 to 8 cells, and analyze that cell for specific genes. So for instance, if I had a couple where each of the parents carried the gene for cystic fibrosis, it means their child would have a 25%. It means their child would have a 25% probability of being affected by cystic fibrosis. So what we can do is we can biopsy the embryos, do PGD, see which embryos are unaffected. They would be our primary ones to transfer. See which are carriers and see which are affected, and absolutely not transfer those affected. So this allows couples to have the choice to have a child without a genetic disorder, without even thinking about abortion or terminating a pregnancy. And this can be done for sickle cell anemia, cystic fibrosis, lots of genetic disorders. There's hundreds of them. In addition, we can also look at the chromosomes. So for instance, you know, one of the things that we see as reproductive endocrinologists is recurrent pregnancy loss. If we work the couple up, and it's a very comprehensive workup, and can find no factor to correct, one of the things we might recommend is to undergo in vitro fertilization, have the embryos biopsied, and actually scan for 10 or 12 of the most common causes of what we call aneuploidy, or abnormal chromosomal number, and see if there are any normal embryos that remain so that we can transfer those and improve their retention rate. And this has helped couples that are 38 and younger. One of the limits of these technologies is they cannot overcome age. And what happens as a woman ages is the rate of aneuploidy increases, so that doing PGD actually confirms what you already would expect. So these are things that you need to ask your specialist whether their clinic can perform, whether they have the ability to do PGD, whether they have the ability to take sperm and put it into the egg, because you want a center that's comprehensive to take care of your needs.